Welcome back to Living Pain Free with Dr. Marc Darrow. I'm your host, Nita Valens, and we are taking your calls all hour right here in the studio. That number is 866-870-5752, 866-870-5752. And you want to check out Dr. Darrow's website at www.lastemcells.com. That's lastemcells.com. You can email him off of every page on the site and watch him performing these treatments on videos. Very exciting stuff, Dr. Darrow.
I still love it. I've been doing it 25 years, and everyone goes, "Why don't you retire already?" I go, "Because what would I do? I would miss this. I couldn't live without it." And I've used it on my body for 25 years, and it's worked every time I've done it. So I'm excited about my work.
Plus, you're wired to help people heal. You're wired.
I think so. I think that's what it is. But this is really interesting. Brian is calling in right now, and his left wrist is bothering him. And that was my first injury, is my right wrist. And Nita, you probably remember this. I was playing golf, and I hit the ground instead of the golf ball at about 100 miles an hour.
Ow.
And hyperextended my wrist and sprained the ligaments. I still have a lump there, which I'm showing the camera right now. I've got what we call like an osteophyte. It's arthritic. But that didn't come on for a while after the injury. The tendons got separated a little bit. And then when things heal, sometimes you have some calcium deposits on it, which this is. But I have no pain. And I went to a conference on what was called prolotherapy in the old days, which was injection mainly of things like sugar water, sodium moreuate, zinc sulfate, things like that, which created irritation, and then fibroblasts would come to the area and spit out some more collagen or cartilage and help grow the area back. So a doctor did that to me, and it got stiff for about 24 hours, and then all of a sudden it was about 50% better. I then injected myself, I don't remember how many times, 3 or 4 times, and my wrist completely healed. And I can play golf, I can throw baseballs, I can do whatever I want, I can lift weights. My wrist has not bothered me in so many years, I can't even remember. This was like 25 years ago. Since then, I've self-injected my knees, my shoulders, my elbows. I've had other people do my neck and my back because I can't reach there. I had broken ribs that I had injected. So Brian, what I'm telling you is this stuff is working on me, and hopefully it can work on your left wrist. What happened to your left wrist?
Well, I honestly don't know what caused it, but it could have been a golf-related.
Okay.
But so it's my left wrist, and go to the doctor, go to get an X-ray.
Yep.
There's a separation in the tendon.
Okay.
In the lower part of the palm, where the palm and the wrist meet. I don't know the official name of what it's called, but a couple of doctors have looked at it. 2 different ones. Both hand specialists.
Okay.
They look at it and say, yeah, this is the cause of your pain. So the pain is frequent, constant, with everyday, basic functions of grabbing something, holding something.
Well, I've been there. I'm so sorry you're going through this, because I know what that feels like. It's very painful.
So right now, where we are, as it prompted the call, a hand surgeon says he wants to do a neuroectomy.
Okay.
Which is to cut 2 nerves right there in that general region that will relieve the pain.
Okay. I don't think that's the way to fix it, but that's my my humble opinion.
What did you say? I'm sorry, you broke up.
Okay. In my humble opinion, I wouldn't cut it.
You would not?
I would not cut a nerve, no. I'm not promising you I can help you because I haven't touched the area, but what I'm visualizing is, a tendinopathy where it connects to the wrist. And that might be something that we can just inject with a teeny, like a 30 gauge needle, like a acupuncture type needle, without much trauma.
Okay.
and stimulate tissue to regrow that connection. I don't think cutting nerves is a good thing for anybody. I see it all the time, or burning nerves.
Sure.
I don't like that. I'd rather fix the area.
Right. Well, okay. I like the sound of that. So I'm glad I called because, I've been on the fence about this. I was going to get a second opinion yet from another hand doctor.
Well, I wouldn't go to the same kind of doctor to get a second opinion.
Really?
Well, you can. I mean, it's always good to
talking to you.
Look, if you're thinking of getting a nerve cut, I'd get 100 opinions before I did it. You know what I mean? I'm being facetious.
Yeah.
What I mean to say is, typically, yes, it's good to go get a second opinion from the same kind of doc, but generally they think the same way. And
right.
If you can do something conservatively with just a quick injection and walk out, no anesthesia that can cause problems, no infections that can cause problems, no dead nerves that can cause problems, then why wouldn't you consider going to a doctor that does that instead for a second opinion?
Yeah. I don't know why I wouldn't. That makes sense. I didn't know that. Frankly, didn't know that was an option.
Well, I'm not sure it is.
That wasn't given to me as an option.
Yeah, right. I don't know if it is an option, but I'd have to touch the area and watch you move it to know. I could tell you, in 10 seconds whether this will work for you or not, or whether it should work.
Okay.
The should is always the big case because we might inject you and then you go out and play tennis right afterwards and don't let it heal. You know what I mean?
Mm-hmm.
Or play golf. So part of the healing with the work I do of injections with cells from your body, platelet stem cells, is you got to rest it and let it heal again. And a lot of people won't do that. And they go, "It didn't work, doc." And I go, "You didn't work it." It's no fun not doing your sport or your work or whatever that is, but sometimes you need to let the tissue grow in. When I tell people about this, everybody wants to go back to whatever they were doing before because I made this up. Healing is inconvenient.
Mm-hmm.
Everybody wants to be healed yesterday, but no one wants to do what it takes to heal. Nobody.
Mm-hmm.
Unless they're so miserable, they go, "I'll do whatever you tell me to do," which is common also. So, from what you're telling me, I think I can help you, and I'd have to touch it and move it around.
How do I schedule something with you?
Just write this down at the phone number to the office, and there are people there now. It's 800-300-9300. And if the phones are busy there because the radio show, just leave your phone number and someone will call you right back. And
great. 300-9300.
800.
Okay.
800-300-9300. Yeah. And for those of you that want to call in, we have other callers waiting, but we'll get to you. If you want to call in the show now, the number here is 866-870-5752. I'm going to repeat it. 866-870-5752. If I can save someone from a surgery...
Thank you.
Thank you, Brian.
Take care.
Appreciate your call.
Brian is in a hurry. If I can save someone from a surgery, which I do every day, I'm a happy man.
Yay.
That's the white horse that I ride. I've been saving myself from surgeries and from thousands and thousands of patients over the last 25 years. I'm very proud of my work. And I love my life because I've been able to do this. It's not a negative statement about the surgeons. They do what they do. I do what I do. We don't necessarily respect each other, to be honest. And that's just the way life is. They have their religion of medicine. I have my religion of medicine. And in my religion of medicine, I'm conservative. I don't want the body broken open or cut open to try to fix things. I think that's... Paleolithic, meaning ancient, and there are less and less of those being done now because people are reading about regenerative medicine using platelets called PRP, platelet-rich plasma, and stem cells, and they don't want to get a surgery. They're getting smart.
Indeed they are. Should we talk to Kent?
I would love to. Kent, Kent. Marc Darrow, how are you? Dr. Darrow here. And you have hips, back, and upper thigh stuff going on. Which is the worst of that?
Hello?
Yeah, can you hear me at all?
Yeah, it broke up a little bit. Can you hear me
Okay.
all right?
I hear you great, man, but you could yell at me and you won't hurt my feelings.
I'm sorry. Is that any better?
Yeah, that's good. So which part of you hurts the
Okay.
worst, your hips, your back, or your upper thighs?
Well, it's an unusual situation. It's a burning pain that one would feel in the upper legs, rear end, and I call it interesting what you had just addressed a little while ago about people calling it hip pain in the hip area. It's a burning sensation and pain that comes as if you were doing a whole lot of exercise, like you'd run and you'd gone to your limit and you keep going. In other words, that kind of disaster that you've created for your body by not stopping. It's not that that's what happens, but that's what the pain is like.
Are you having it right now, Kent?
Do I have it right now?
Yep.
I kind of have it all the time. What it makes really difficult is that it's difficult in walking.
Okay.
I try to, because of the cardiovascular situation, I need to do, cardio exercise, but
Sure.
I'm kind of inhibited because of this situation.
How old are
from
you,
doing
Kent?
That. I feel
How old are you?
I'm 78.
Okay. Boy, you sound so young, man. That's great. There's a lot of things. Go ahead. I'm sorry.
I feel young, but I'm troubled because I've been to a number of doctors. I have maybe some, and I don't want to take up too much of your time. But
No, it's good. This is good information for all the listeners.
Well, I've got some competing situations, and I've gone to physical therapy to try and cure the situation because I've had unfortunately, a number of different things going on at the same time. I've had some really great orthopedic surgeons who've wanted to do surgery, and in due respect, much like yourself, I've said if I don't have to cut into something, I'd rather not do it. And they kind of, humoring me, have treated me in that capacity. So I've had a number of situations that occurred, but probably the most relative is that I haven't broken any bones really at all, and it played rugby, surfing, football, a lot of physical stuff, but never broken any bones. But I had a fall, and I had a fracture which was only found too many weeks later. I had a fracture of lower lumbar and upper lumbar and neck.
Okay.
And I was trying to deal with that, where they had recommended the neurosurgeon that put me into physical therapy because they didn't want to take the risk of surgery to remove the pain. It was kind of like the patient's choice. How bad is your pain? There's a risk involved with surgery. I, in a normal sense, said, well, if there's a risk, I won't do that. I'd rather try and work it out, much like you said, doctor, that try and let things self-heal. I've been fortunate in that sense for a long time. But in this regard, that situation has gone on where I've had this, and it continues with the lower back, upper back, and neck, which is kind of constant pain, mostly neck and back. But what compounded that is this other situation in a somewhat different area, but it's where I call it hips, front legs, and rear end, where this burning, debilitating situation has occurred. And
let me ask you this: did your surgeons tell you what the problem is? Did they say there's impingement on a nerve?
They've tried to indicate that, well, maybe there's because I've been to neurologists, I've been to neurosurgeons. Their best assessment was, if you don't want to do surgery, it's physical therapy.
No, I got that, but do they give you the reason why you have it?
No.
Okay.
Other than the fact that my sense, which they've kind of dismissed, is I had a kind of a major surgery about a year ago.
Yep.
Because of the investigation with the MRIs for the back.
Yep.
They found that I had a severe vascular condition, totally separate, that had to be attended to right away.
Okay.
So I had like a 5-hour operation Well, they went through that vascular repair, kind of center body vascular repair, major area with the artery. In that process, I was had a problem at the end of surgery where the blood pressure hit the basement, and they had to do a bunch of stuff to bring things back up.
Okay, is that when these symptoms started after that surgery?
Yeah, and what happened was I was then put into ICU. I could not get out of bed. They didn't want me up because of what had happened with the blood pressure drop.
Okay.
I was then in the hospital for something that should have been maybe seemingly as major as the operation was. It was maybe
so. Let me tell you something. Let me just say something. I don't mean to cut you short.
I'm sorry.
Because you have a great story to tell. I need to see you to give you any more information. This is just, you have a vastly complex medical condition. It's okay. It's okay. I love listening to your voice. You got a sweet voice. But there's nothing more I can tell you at this point. You need an examination. If you want to come into the office, the number is 800-300-9300, and I'd be glad to look at you. I'd be able to tell you probably in a couple of seconds if I can help you or not. Okay?
Well, I appreciate that. Like I say, everybody, very good doctors. Don't know what to do, but it's kind of everything's overlaid on itself.
I hear you.
So I'm kind
You're
of
complex.
A weird case.
But the bottom line is it may not be complex. It may just be that those guys do what they... It may not be complex. The story is complex.
Well, I appreciate that attitude.
Yeah, but until
you're a positive force, Doctor. I enjoy listening to you.
I hope so.
We enjoy you, too.
Yeah, you're a good man.
Well, thank you.
We appreciate your call very much. Anyway, I'm going to give you the number one more time. Write it down, 800-300-9300. That's to my office. If you want to come in sometime, I would love to touch the areas and see if I can help you. I think I can help some of it. I'm not sure I can help all of it. And that's it. That's the end of the story on the radio. God bless you, man.
I'm very frustrated because it's like being a stroke victim the way I walk, but I'm not.
Yeah,
so I'm troubled in that sense. So any help I would really appreciate. So I will certainly do that.
Yeah, God bless you, my friend. Thank you so much for calling.
Well, bless you as well.
Thank you. I appreciate that.
Thanks for your call.
Thank you very much.
For other people to call in, we'd love to talk to you. If you have any musculoskeletal complaints, things that hurt, give us a call right now live at the studio, 866-870-5752.
So, Dr. Darrow, when I was leaving to come here this morning, I ran into some neighbors, and I told them to listen to the show, and because I recently got more books and materials from you for all my neighbors, and they asked me about carpal tunnel syndrome.
Okay.
I said, well,
that's typically is a nerve impingement, the median nerve, MEDIN nerve, which starts up at the neck and through a whole bunch of different pathways ends up through what's called the carpal tunnel, which is the carpal bones and then tendons around that. So the nerve can get entrapped, meaning that overuse does it. So people that work with their hands, we get a lot of postal workers, we get guys that shoot guns a lot. Actually, we can get people who are, sew a lot. Anything that's repetitive, write a lot.
Sew, S-E-W, that's me. That's me.
Yeah, but you don't have carpal tunnel.
I'm not so sure about that.
Okay.
We'll talk.
Okay, so carpal tunnel ends up being either or both weakness in the hand and then what we call paresthesias, which are funny feelings. And those funny feelings, these paresthesias, can be caused because the nerve has been impinged, just like if you had a sciatica, or funny feelings or pain down the leg or down the arm. So these things can be remedied sometimes, and in the carpal tunnel, we can do what's called a hydrodissection, where we put a solution around that nerve, very, very close to the nerve. We have to do it under ultrasound guidance so we can watch the needle and not poke that nerve, and then separate away the tendons from that nerve and let the nerve heal. Okay? And a good thing to try at home is to get one of these braces that goes all the way up, halfway up your forearm, so the wrist doesn't move, and you sleep with that. And a lot of times people end up with carpal tunnel from irritation during the day, and then at night, when they're asleep, the wrist goes into a hyperextended position or flexion, and then the nerve can be tweaked even more. So wearing that brace can sometimes, that's the most conservative way of healing the issue. Enough information, Nita?
Excellent. Thank you.
All right.
Hopefully she is listening, this person I saw. So
Well, she's your neighbor. You can go tell her.
Well, I will tell her. I wrote this down, what you just said.
So what am I going to do next? Let's see. I'm going to talk about the
Give the phone
vampire
number?
facelift, which is, Nita, you're so jumpy today, which is the vampire facelift is injections of stem cells or platelets, PRP, in the face to regrow the collagen in the face, make you look more beautiful or handsome. And then it can also be used on the top of the head if your hair is thinning, to revitalize the follicles and thicken up the hair. So those things can be done. And I'm going to go to a question right now. It says neck and back pain.
Okay.
And hello, it says, I suffer from neck and back pain. That's simple and complex. So when people come in with neck and back pain, or neck or back pain, generally it's not from what their MRI shows, which can be herniated discs or facet arthropathy or stenosis or things like that. A lot of people come in saying, I need to get a surgery for a stenosis. And I go, no, you don't. You might, but from my examination, it shows that's not the problem. So everybody needs an examination to find the pain generator. And most necks and backs, regenerative medicine of platelets and stem cells can help heal, because most of it is just loss of integrity of the ligamentous structure, or what we call Nita's favorite word, an enthesopathy, where the tendons, ligaments attach to the bone. And we can heal that up usually pretty quickly. I've had that done on my neck and back, my entire spine actually, many, many, many years ago, 25 years ago. I had that from many injuries with gymnastics, golf, surfing, you name it. I was pretty beat up. And I am doing sports again, feeling great, and hopefully you can do that too. So we won't get into big issues about that. I'm going to go to one last question. It looks like we only have a couple minutes left.
Right.
Terrible back pain. Did I do this one last week? My wife had the lower areas through L5 fused in 2 previous surgeries. This surgery addressed T12 to L5. Came home 3 days later, got in bed and with such pain you couldn't touch her. Went to the hospital 2 days later and had another surgery where they fused. It says here T13, but there is no such thing. Time's up. God bless you all. Nita, thank you so much. Alex, Suzette. If you want to get me at the office, the phone number there is 800-300-9300. Give us a call there, and we can answer all your questions.
Thank you very much. And listen to Warren Eckstein on The Pet Show, 11 to 1 every Saturday, and we'll see you next time.
You've been listening to Living Pain Free with Dr. Marc Darrow. Now that you've heard Dr. Darrow, you can schedule an appointment to talk with him in person by calling his office anytime at 800-300-9300. That's 800-300-9300. Or go online to lastemcells.com. Again, the website is lastemcells.com. Living Pain Free with Dr. Marc Darrow is heard Saturdays at 10 a.m. and 1 p.m. and Sundays at 5 p.m. right here at AM 870 The Answer. Remember, to take the first step toward a pain-free life, call to schedule an appointment at 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.